Okay, now we're going to work on trunk rotation. Grade 5, you're going to start with the hands, bend your elbows. Hands are going to be on the side of the head, and if we're going to bend from right shoulder to left hip, it's going to be the right-sided external obliques and the left-sided internal obliques. Conversely, if we're going to go from left shoulder to right hip, it will be left-sided external obliques and right-sided internal obliques. So what you'll ask your patient is try to clear the scapulae off the table going right to left, just like so. So that's what I want you to do. Go ahead and try that for me. No. So your hands are your side, and you go from right side to left side, just like that. Go ahead and try that for me. Okay. And a grade 5, again, would be a nice controlled motion, making sure that scapula clears and very controlled. You're going to go to a grade 4 at this point, cross the arms just like doing the trunk flexion. You're going to try the same thing, okay? Come off that table, bring your right shoulder to your left hip. Good. Now a grade 3 is going to be arms outstretched in front of you. So take this side and go just like that. If you can, keep your arms like straight out in front of you. Go ahead. And again, you're always looking for that scapula to be clearing off the table. Grade 2 positioning is going to be the same as a grade 3. With the arms outstretched above the plane of the body while the patient is supine, you as a therapist is going to be standing at the level of the waist, and you're going to be palpating that external oblique first on one side and then on the other. And you're going to instruct the patient to keep your chin, again, pointed toward the ceiling, lift your head and reach toward your opposite knee. So take this right hand and try to reach down toward this opposite knee. So again, what you're looking for there is the patient is unable to clear the inferior angle of the scapula from the table, so that is going to be assigned a grade 2. When observing this contraction, you have to make sure that the rib cage is going to be depressing again during the testing activity. Now when you're going to be testing for grade 1, you can cradle the patient, so you get them cradled here. And because I'm going to go from right shoulder to left hip, I'm going to go along the rib cage here, and I'm going to try to palpate those external obliques. And you're going to try to assist them to get into this position here. So again, you're feeling for contractile activity here. And if you're going to be doing internal obliques as well, so you got to go to the other side, the contralateral side, and you're feeling for internal oblique activity here. And you also obviously need to test the other side. So I will not obstruct the camera's view to do that, but I would, again, come from the other side and help her from this left shoulder to right hip. So of course a grade 1 is going to be the therapist can see or palpate the muscular contraction, and then a grade 0 is no response from the oblique, internal or external.